Hi, my name is Amy, and this is my head to toe assessment video. To start off with, I'm going to go ahead and just verify the provider's orders and be oriented with the patient's chart and kind of know what surgery they had. And then head to the patient's room, make sure I have the right room, close the window, door, or curtain to give them their privacy, and introduce myself. Hi, my name is Amy. I'm going to be doing your head to toe assessment today. Can I get your name and date of birth?
Adam Riedel, 4491.
Perfect. And I'm going to go ahead and do my hand hygiene and put on some gloves. And do you know what month it is?
It is March.
Perfect. And do you know where you're at?
I'm in the hospital.
And who's the president?
Joe Biden.
Perfect. So he's oriented ×4. And now we're going to go ahead and start with vitals here. So I'm going to check your blood pressure and also your pulse with the pulse ox and your oxygen. So we'll get that going. And that's, I'm going to just check your blood pressure. Your blood pressure is normal. I got you at 120/68. Good. And I'm also going to get your temperature right here and go through your ear and make sure your temp's fine.
What was my temp, nurse?
It was 98.3.
Ah.
So it's dead on normal. And I'm going to also kind of just check your pulses here. And I looked at your pulse ox, so your pulse is 68, which is great. 97 for your oxygen, which is good. And then while I'm just checking and feeling your pulse, I'm gonna count your respirations here, which I wouldn't tell the patient in real life. Perfect, I got you 8. ×2 is 16, so your respirations are normal. Now I'm gonna go ahead and start your assessment. So I'm gonna start off with your head, and I'm gonna just take a look throughout your hair, make sure there's no dry skin, rashes, or any creepy crawlies in there. Good. And are you having any pain?
I am having a bit of discomfort.
Where are you having that discomfort?
In my abdomen.
Okay. And he just had a laparoscopic appendectomy, so that makes sense that he's having some pain in his abdomen. What would you rate your pain on a scale from 0 to 10? 0 being no pain, 10 being the worst pain you've ever had.
I would rate it a 3.
Okay, good. Perfect. Any headaches?
No.
Any lightheadedness, dizziness?
No.
Okay. I'm gonna go ahead and start off with your eyes. And it looks like he wears glasses. So are you nearsighted, farsighted, difficulty seeing near or far?
Far.
Far, okay. And let me just check your pupils here. Pupils. Okay, and those look good. And I'm gonna have him track with, have him follow my finger with his eyes. This is just a fast neuro exam. Good. And so that looks good. And I'm going to palpate his temporal artery. Perfect. And I'm also going to press on his sinus. Any maxillary tenderness there?
Mm-mm.
Okay. No tenderness up here?
Mm-mm.
Okay. And then I'm going to have you turn your head that way. And I'm going to just check in your ears. And usually I'd use an otoscope. So I'm just going to pull that back and look in there. No cerebral impaction. And I'd technically be able to see your your tympanic membrane. That looks good. And that way, perfect. No redness, swelling, or drainage. Good. So your ears look normal. Now I'm gonna go ahead and have you lift your head up. I'm gonna check in your nose. Perfect. No polyps or deviation or swelling. Now I'm going to have you check your, so one side. Now switch. That looks good. Normal nasal flare. Okay, now I'm going to have you open your mouth and kind of take a look back. So it looks like you don't have tonsils if you have a tonsillectomy. Got it. And your uvula looks normal. No postnasal drainage. Mouth and mucosa normal. His teeth are in place. Besides 2, looks like you have a retainer in. Good. Okay. And now I'm going to go ahead and just fill your neck here. And kind of check your jugular vein. Also check your artery. Check for any maxillary or any swollen glands. That feels all normal. Perfect. Okay, and now I'm going to go ahead and check your arms here. So if you want to give me this arm right here. Perfect. Just look for any rashes or lesions. I already checked his pulses, so those were good. And then check capillary refills. Make sure those are all normal. And turn. Perfect. And then if you can just pull my hand in, and also pull your arm towards yourself. Perfect. And push away. Good. And I'm going to do it on this side too. Other side. Okay. That looks good. Now pull my hand in. Perfect. Pull your arm in. Push your arm out. Okay. And now push my hands out if you can. Okay. Now push them in together. Okay. You're good. Your strengths are normal. That looks good. And now I'm going to go ahead and assess your lungs and your chest. So normally I would have them have their gown open to the back so you can hear a little bit better without having to go through the clothes. And I'm going to have you take some deep breaths for me.
Okay.
We'll just let them yawn for a second here. Okay. And check your side over here. Good. And I'm going to have you keep doing a few deep breaths. One more. Okay, I lied. One more. That sounds good. Okay, so bilateral lungs are clear. Now I'm going to go ahead and actually check your heart rate. Good look done. And then I'm going to switch to the bell. Also just check for any like murmurs. And I can also check his carotid. Any sounds? Good. Okay, so your heart sounds good and your lungs sound good. I'm going to go ahead and have you lay on back, and I'd probably assist him just because it's probably tender. He did have like a laparoscopic appendectomy, so he will probably have a few lesions or incisions. And let me just go ahead and adjust this down. Perfect. So normally I would have them lift up their gown so I can kind of see their stomach. In this demonstration, I'm going to let them keep it down. And I'm going to go ahead and listen to his bells, each 4 quadrant. Gurgling going on, and I'm just going to go ahead and palpate and very softly.
Oh, that's tender.
Is it tender? Is your pain worse?
Yeah.
Okay, what would you put it at now from a 0 to 10?
Like a 6.
A 6, okay. And we could always go back on the chart and see when he last had pain medication and if we need to give him another dose, and just make sure his bandages aren't soiled and need to be replaced. Okay, and I'm going to go ahead and check your legs here. So I'm going to go ahead and check your tibial pulses. And look for any edema. So no edema. Your tibial pulses are good. And I'm going to check your pedial pulses. Those feel good too. And I would go up, if need be, check up here. But except the tibial and pedial pulses are good, I assume that one's going to be fine. So you can go ahead and I'm going to check your strength here. So kick your legs out. Perfect. Pull your legs in. Good. And I'm going to take a look at your feet here and your toes and make sure they're normal color. No lesions or skin breakdown or blisters. I'm going to do this leg too. Okay, and I'm going to go ahead and help you on back up to a comfortable position. Any other concerns I need to be worried about?
No.
Okay, well let me go ahead and let the doctor know what your pain is and your vitals, and I'm going to go ahead and wash my hands and document my findings, and that's my head to toe assessment. Thank you.